Good afternoon, everyone, and a very warm welcome to today's webinar, The Fine Print on Health Insurance, organized by Vayah Vikas. On behalf of Vayah Vikas, I welcome all of you to today's webinar in collaboration with Grey Up. Before we begin, we would like to share an important initiative by Vayah Vikas. Vayah Vikas is currently raising funds to support vaccinations for senior citizens, particularly protection against influenza and pneumonia. Preventing healthcare plays a crucial role in reducing complications and hospitalization among seniors. We will be sharing the scanner link in the chat box and we request your kind support for this meaningful cause. Every contribution, big or small, can help protect a senior citizen. Coming to today's session, this promises to be highly relevant and insightful discussion. Health insurance is a subject that affects every family, yet many of us only discover the important details when we actually need to make a claim. Today's session is intended to help us better understand the fine print, avoid common pitfalls, and make more informed decisions. We are delighted to partner with GreyUp for this webinar. Founded by IIT alumni, GreyUp is a movement dedicated to protecting the health, wealth, and happiness for senior citizens. Their work focuses on important areas such as health insurance, will making, and senior specific tax planning, helping seniors, their families navigate important life decisions with greater confidence. It's now my pleasure to introduce our speaker for the session, Mr. Rahul Venuraj, founder of GreyUp. Mr. Rahul is an alumnus of IIT Kharagpur, where he completed his BTech in computer science in 2001. He began his professional journey with Siemens, working across Bangalore, Germany, France, and Mumbai over 7 year corporate career. He later pursued his MBA from the NUS Business School in Singapore and subsequently worked with Singapore government in a strategy role. In 2011, inspired by the early startup movement in India, Mr. Rahul transitioned into EdTech sector where he held several leadership positions and contributed to improving learning outcomes over 10 lakh children. After spending 13 years in EdTech, he founded GreyUp in 2024 with a clear mission to help de-risk the lives of senior citizens through support in areas such as health insurance, will making, and senior focused tax planning. With his rich and varied experience across technology, strategy, education, and senior well being, Mr. Rahul brings both expertise and practical insight to today's discussion. We are truly delighted to have him today with us. Over to you, Mr. Rahul.
Yes, Ashwini. Hi, thank you. First, quickly, just want to check, is my screen visible to everyone?
Yes.
All right, perfect. Okay, so good evening, everyone. Really a pleasure to be here. It's my second time having this talk with members of Vayah Vikas. So for some of you, if you have attended it the last time, sorry, there's going to be a little repetition, but it's also a good refresher, I think, for some of you, because our session is usually packed with a lot of important information. And so this can maybe bring back some of the important key points that you need to keep in mind. Okay. So again, as Ashwini said, so my name is Rahul. I'm the founder of GreyUp. And what we basically do is we try to help seniors with what we call our retirement essentials. One of the key things that is a retirement essential and where we spend, I would say, more than 70% of our working hours on is on health insurance. Health insurance, of course, can be complex even for younger people, but it's even more important to simplify for older people, given that the probability of getting hospitalized is a lot more for senior people as they age. Unfortunately, it's a very agent-driven business who are very commission-focused, and this is where the root of the problem lies, that most people are told only of the good parts of their plans and not so much about some hidden conditions. And hence, the title of the presentation today is called The Fine Print of Health Insurance. Those little things that lead us to not get our claims at the end when we eventually use this policy someday, right? So let's try to understand that. I'll begin very quick. We have a lot to discuss, so I'll try to go through whatever I have to share. It may take about 40 minutes or so. And then we will open the floor to questions. Your questions could be related to points that we discussed, that I've tried to teach you on today, or it could also be any other question that you have. Feel free to let us know. Okay. So with that, let's begin. So the first thing is that, as you know, health insurance basically covers your hospitalization costs, right? When you get hospitalized either for a few hours or for a few days, the costs in India are quite high. Uh, of course, this is common for all ages, but when if you really think about it, the real prime time when you need health insurance is post probably the age of 60, because this is the time when the incidence, the number of times you go to hospital increases. The average bill size also increases for most hospitalizations at the older age. And of course, the thing we have to also keep in mind is that seniors generally have limited income, right? They are retired, they have some income coming from a few sources probably, and suddenly if they get an unexpected shock, that is, if they have a plan and they expect the insurance company to cover that, but instead of that they don't get any coverage, or they get only half the bill or something, it can be a real jolt to their financial system. Okay, so this is what leads to the wealth erosion that we're seeing here. But the good news is that it can all be solved early with timely action. Okay, the problem is that in some cases we wait too late, and if you wait too late, nothing can be done. So after a serious hospitalization or after a serious illness, it is very difficult to actually change anything in your plan. Okay, so that's something that we'll see now. So let's see what is the root cause. So the main problem in India is that health insurance is very complicated. And what is the root cause of that? Mainly, the root cause is what we see here called medical inflation. So, most people may know that the inflation rate in India, that is the rate at which the costs are increasing for general things that we buy, from our food to clothes, travel, etc. This is increasing by around maybe 5-6%. But there's another term that is actually tracked, and you can Google this as well, and that is called medical inflation. And the medical inflation in India, not this year or last year, for the last decade or so, is hovering around 14%. Okay, 14% medical inflation means the cost of anything related to the medical industry is increasing by 14% every year. And that's not one of the highest in Asia, it is the highest in Asia, and it's one of the highest in the world. There are many reasons for this: less supply, more demand, our habits have changed, our health has deteriorated over time, there is extremely high medical tourism, there was effects of COVID-19. A lot of reasons that are leading to this, but effectively, what I want everyone to understand from this slide is that medical costs are increasing by 14% every year. That's called medical inflation. And when you do the math, that means that a surgery cost doubles every 5 years, slightly more than 5 years. That is, every 5.14 years, the cost of a surgery doubles. So if there's a surgery today that's about 6 lakh rupees, another 5 years, around 2030, 2031, it will be about 12 lakh rupees, then closer to 20 lakh rupees. If you go backwards as well, you'll see that this surgery, which is today 6 lakhs, was only around 3 lakhs about 5 years back. Okay. So medical inflation is something that we keep in mind, and that is why a health insurance becomes even more critical. So when there is such inflation of 14%, what is the impact on that 14% to each of us? The first thing is obviously medical expenses increase, nothing to do with insurance. The medicines that we buy, any medical equipment like wheelchairs, oxygen cylinders, ventilators, etc., all that is getting costly. Hospitalization, of course, which is kind of the focus of today's presentation, also increases in cost. And caregiving, that is nursing or even the doctor's charges, etc., are all increasing by this percentage. Okay, but more importantly, for this presentation, because hospitalization prices increase, the next most critical component, impact rather, is health insurance premiums are increasing year on year. Obviously, if the cost of a heart bypass surgery last year was X, this year it is 14% more. Next year it is another 14% more. The year after it's another 14%. And obviously, the premiums that insurance companies collect to cover that same bypass surgery year on year also will increase, right? Now, this is where the game is tricky, and this is where health insurance becomes very complicated in India. Because, on one hand, insurance companies are pressurized to increase the premiums because the costs are increasing. But on the other hand, less than 10% of Indians have health insurance, their own health insurance policy. So there's a lot of competition. So all these companies are trying to fight for that 90% or so or more of people who don't have health insurance. A very nascent industry comparatively compared to developed countries. And so what is the solution that these insurance companies come up with is there are a bunch of features in insurance policies, but they cannot put only plus points in a single policy, because if they put only plus points in a single policy, the cost will go very high, and so they cannot compete with other insurance companies. So every single policy in India, it will have plus points and minus points. And the key thing I want you all to take away from today's discussion is which are the plus points we should definitely have, and which are the minus points that we should never have. We should avoid, even if we get some discount and other things, because otherwise you will have trouble at the time of claims. Okay. So, to understand what are these things that can go wrong, here's a quick example. Okay, so here's a person who has about 15 lakh rupees of cover. Okay, so there's a person, he has 15 lakhs of cover, and he gets hospitalized for a surgery, and this is the bill that the person gets. Okay, so I'm just going to go through this bill a little bit. So the person was in hospital for total 7 days. That 7 days, there was a room that was allotted to him, which was 10,000 rupees per day, 70,000. In that, say, 7 days, there was something critical that happened. So maybe during when he just got hospitalized, or maybe some complication in between, he was in ICU for 3 days, and that ICU charges 20,000 per day, so 60,000. The surgery was done, which is 2,50,000. Tests were done. A lot of tests are usually done before the surgery, sometimes even after the surgery, to check if everything's okay. That's 1,20,000. A bunch of medicines were used for the treatment, which came to around 60,000. And the doctor's visits, right? You know that a doctor, usually, if you're hospitalized, will come twice a day. Once in the morning to see if the patient is okay, how was the patient's sleep, is the pain reduced, etc. And once, usually, just before the end of the day. So they come twice a day. So 7 days, the doctor visits were there. So 14 visits totally in 7 days. So this comes to 42,000. So the total bill here is about 6 lakhs. Okay, 6 lakhs 2,000 to be precise. Now this looks like, for most people, it looked like even to me for that matter, some time back, it's an open and shut case, right? You have a 15 lakh rupee cover and your bill is not even half. So let's say you pay this money in the hospital and you go to the insurer to get this covered. Okay. Or it's a cashless network and the insurer sees this, and now let's see how the insurer reacts, right? So the insurer will first say, sir, your bill is 6 lakhs. But the first thing I want to tell you, sir, that there's something called a room capping. Okay. So there's a room rent capping in your the room that you took was 10,000 per day. But if you go and read your policy carefully, you will see that we have mentioned clearly that your room rent limit is 5,000 per day. Okay. So then you will be surprised. Most people are usually surprised when they hear this for the first time. And then they'll say, okay, so what does this mean? So you'll say, sir, that means I can only pay you 5,000 per day. So if you come back to your original bill split, instead of 10,000 for 7 days, I can give you 5,000 for 7 days. So I can give you 35,000. So you'll be like, okay, no problem. At least out of 6 lakhs, you do one thing, you give me the balance, 5,67,000. But then he'll say, sir, there's one more thing that is about your ICU charges. And your ICU charges also, if you see your policy, it says it's double of your room rent. So it's 10,000. So usually that's a general rule of thumb, everyone, that whatever is your room capping, usually your ICU is double of that. Okay. But then the problem is in the hospitals also, usually whatever is your room rent, the ICU is also double of that. So now in this case, the insurer was covering 5,000 in the room, and here they are saying that they can give 10,000 for this. So instead of giving 60,000 for the ICU, they're giving you 30,000. Okay, so that means they've cut half here. Okay, so they've cut 35 here, they've cut 30 here, they've cut 65. I would say still, it's not great. You didn't expect to pay 65,000 from your pocket, but I still think overall in the scheme of things, it's not bad. You still save 5,37,000. But this is where it gets interesting or rather scary. At this stage, when you are, really upset, and you're getting little upset, and you're thinking, okay, fine, at least I took a good room, so my family was comfortable, so maybe it's worth the 60,000, 65,000 is worth it. He is going to pull out the most hidden clause, which is there in almost all policies in India. Okay. So the next thing he's going to say is, sir, you also have a clause which is mentioned in your document. Please read it, called proportionate deduction. Now, please don't read it. I'll try to explain it to you. Okay. So, what proportionate deduction is saying is that whatever percentage of your room rent is covered in the bill, when the insurer is settling the bill, no, whatever percentage of the room rent the insurance person covers, everything else in your bill other than medicines, which is on MRP, so medicines are not touched, but everything else will be covered in the same percentage. This is important. So most people think that you only have to pay the room rent difference in both these cases, which is 30 and 35,065. But that's not how any hospital works. It is, the insurer will say very clearly that whatever percentage of your room rent is being covered, everything in your bill, that final bill, except medicines, will be covered in the same percentage. So now the question is, before we even just try to understand why, right? Why can't, usually if you go to a hotel and we stay in different rooms, still if you go to the restaurant in the hotel, all of us will get the same bill in the restaurant, right? They're not going to say, oh, you're in a fancy room, so I'll charge you extra, and you're in a small room, so I'll charge you extra, right? So why this proportion? This is something that really surprised us. So we wanted to understand this. Okay. So first we went to the insurer and we tried to ask, why do you do this? Why can't you just get the why can't you just deduct the extra part of the room? So this is what the insurer said, right? So insurer said that, and this is true, and we have verified this, that all hospitals in India follow a differential pricing system. So that means, based on your room, everything from your surgery to the doctor's visits, nursing charges, everything is differentially priced in India. And you can go and confirm this in any hospital. Okay, so what the insurer is saying is, look, you bought the policy from me, say 5 years back. We shook hands. You agreed to take a room of 5,000. If you had taken a room of 5,000, I would have covered everything. But now you have taken a room of, let's say, 10,000, like in this example. Now, because you took a higher room, everything else has become more expensive. That's what the insurer says, right? The surgery is higher cost, the doctor's visits, the nursing charges, the tests, everything has become more expensive. Medicines are not more expensive because they're on MRP, so that I'll cover fully. But everything else, because of your choice of room, if it goes up, I cannot take the burden for that. And that is the reason why we do proportionate deduction. Okay, so this is what the insurer has said, that. So then we were curious and we said, okay, then why are hospitals? So we wanted to understand from hospitals, why do they charge each person differently? Why can't they just charge the room rent different, but keep the costs of everything else the same? And that's when we understood that there is this concept which is not only for India, it is there for all developing countries where you have a lot more poor people than middle class or rich people. We have a pyramid structure, right? If you know, India is a pyramid. So you have very few, very, very rich people. Then you have the ultra rich, then the rich, then you have little more middle class, upper middle class, then you have lower middle class. And then finally, the biggest set of people are the poor. Okay. Now, I think one thing all of us will agree here is that the best medical care in India should not be only for the rich, right? They should be also affordable and available for people who are struggling with money a little bit. And so comes this thing of the medical equality. So what hospitals do, not just in India, but in all developing countries. Imagine if something in the hospital, as an example, is charged at 100 rupees. Okay. So if you charge at 100 rupees in this pyramid, no, a big section of people, that 100 rupees may be too much. They may not be able to afford. Only the people above that, a certain line, may be able to afford. So instead of charging everybody 100 rupees, what they do is they will charge some people 20, some people 60, some people 100, some people 140, some people 180. Now, if you do the mathematics of this, the average is still 100. The hospital does not lose anything. For that matter, they don't gain anything also. It's the same. The average is still 100. But now, in this system, you have an option of 20 and 60 as well. So now a lot more of this pyramid that I told you, this income distribution pyramid, a lot more people can access it. Okay. Now, of course, they could have done this calculation and done this in very different ways, but you have to also remember that once a doctor says discharge, we don't have enough hospitals in India for the number of people we have. So once a doctor says discharge, they try their best to get you out of the hospital and make that bed available as soon as possible for another needy patient. So they need to have some system to do this kind of charges. So how do they do this? They tag it to the rooms. So you take one, so one room, maybe the lowest room, which is the general ward, maybe 20 rupees for that thing. Then a twin sharing room, maybe 60. Then one, the cheapest single room, maybe 100. Then slightly higher advanced single room will have 140, and then 180. Okay. So this is how it works in all hospitals in India. And this doesn't look to be changing anytime soon. So net, just want to make everyone understand here that this is not some scam or anything. Both sides have very valid reasons. Okay. I agree though. Insurers can be more transparent about this when they put a room capping in the policy. When they sell you the policy, they can be more transparent about what that means. On the other hand, hospitals also play a big role in many of these problems. They can be more upfront and they can be more transparent when you choose a room. So when you go to that, when you're in an emergency situation, you go to the hospital, they'll say, you have policy, you say yes, then they will say only these are available. That's the other problem in India. It's always full. The good hospitals are always full. In fact, the not so good hospitals are also almost always full. So it's not easy to get a room in many cases, especially if it's an emergency. So you have to take what you get, and that is where they can be more upfront. So I feel the onus is on us, people who are buying policies, to understand what they are buying properly. Unfortunately, agents don't tell you clearly, websites also don't tell you clearly. So by the end of this discussion, hopefully you have a better idea of what health insurance you need to have. In case your hospital, we'll see solutions of these problems. And if you feel that solutions are needed, better to take action as quickly as possible. Okay. So now coming back, now that we understood what is proportion deduction and why it's there, let's come back to our example. This is where we stopped, where we so now they will apply proportionate deduction on all the other things. Here, these two they already applied. They already said that they are not covering it fully. Now they'll apply this. So when they apply this, no, so basically what has happened here in this example, in this example, your actual room rent was 10,000, but your capping was 5,000. What does that mean? 50% of the room rent was being covered in this claim, in this case. So now they will apply 50% on everything else other than medicines. So the surgery charges became 1 lakh 25, and other things similarly have also become proportionately reduced, right? So this is medicines, as you can see here, is untouched. So the 60,000 bill, 60,000 recovered. But now, unfortunately, you can see that this entire thing has drastically reduced to 3 lakh 31,000. Okay. So now, instead of in this example, even though the person had 15 lakhs of a policy, 6 lakh bill, you're getting 3 lakh 30. And now, even if you're not a BP patient, you'll get high BP at this stage, right? And then just when you're going to get this 3 lakh 31,000, they will say the last thing that, sir, you also have 20% co-payment. This is also one hidden thing that many agents put in policies of people. What is the meaning of co-payment? Means that when you took the policy, right, you agreed to pay 20%, okay, of whatever the insurer has to pay. Insurer was supposed to pay 3 lakh 31. Now it's better to always make sure that there's no co-payment. But there was a co-payment. Maybe you were very adamant with the agent that I will not pay more than 35,000 or 30,000. So you reduce the premium. So when you reduce, he'll say, I'll go and I will do it. But when he doesn't have any power to do it. He can only reduce the price by introducing such limitations. So he introduced a 20% co-payment in many cases. You may not be even aware of it. And so at this stage, 66,000 out of this 331,000 also you have to pay from your pocket. So this is the final amount. Okay. So this amount, 2,65,000 out of the bill of 6 lakhs, is around 44%. So even though you had a high cover of this, cover is the most important thing I want you to understand is, if you want to avoid this risk, which is called partial coverage, you can see on top of the slide, this is the biggest thing. The most common thing that happens in hospitals is, like 80% of the problems you find with health insurance is you don't get the money you expect back, you get only partially. If you want to avoid this partial thing, you must ensure that you select policies carefully, and we'll come to that. Okay, the more you tell them that I will not pay more than this, they will make add clauses to make sure you get it partially. Okay, and this is there in 95% plus policies out there, and this is the first risk, partial coverage. All right, so now there's only one more other kind of risk that's rare. It happens in 10-20% cases, but if it happens, the impact is very, very severe. That is, you get zero. So sometimes they will say, sorry, there is no calculation at all, but you will get zero. Now, what are some cases where you can get zero? The first case is pre-existing diseases. So when you buy a policy, the insurer will evaluate your health to decide whether to cover you or not. So they will ask a bunch of questions. Unfortunately, I have seen in India many people deciding themselves what to tell the insurer and what not to tell. Okay, I think a they seriously think it doesn't matter, but it does. Second option could be they think it's a very common thing, like, I have high BP, but everybody my age has high BP, why to say. But the third and most common thing I think is people think the premium will increase. So instead of paying 35,000, maybe I have to pay 40,000. But you have to understand one thing. It is maybe this will happen. It doesn't happen in all cases, by the way. But even if it happens, let's give benefit of the doubt, and let's say yes, your premium increases from 35 to 40. It is much better to pay 40,000 every year and get your claim fully back at the end than paying 35,000 like donation to them and getting zero because you hide something. And these insurers, I can tell you, they have a lot of ways to find out if you have hidden something or not. Okay, so please be very careful, and please make sure that whenever, and even if you have made a mistake now in a policy that you have, still try to get it corrected by taking an expert's view. Okay, so this is very important. This is the most important fact, because the insurer has a right to decide whether to cover you or not and how much to charge you. And if you hide information, they will say this contract is null and void. Okay, the second reason why you may get zero is there are waiting periods in it's there in policies in health insurance all over the world. There are three waiting periods. I won't get into the details right now. We can maybe look at it at the question answer session, but it is basically there to prevent fraud. Okay, there's a lot of fraud, people hide things. So to prevent, in case people are hiding, to prevent that, there are some waiting periods. And that is why it's important to take policies early so that these waiting periods end. So if you don't understand your waiting periods and you go and put a claim for something which is actually under waiting, you will get zero. That's the second point. The third thing is very important for senior citizens, I would say, and basically the group here is modern treatment. So when you go to a hospital these days, doctors usually give different strategies or different lines of treatment, usually. So they will say either you can do this, take some medicines, but it will not solve it, but it'll go on for some time, but it won't solve it. Or we can do a surgery, or we can do advanced surgery where we can solve it once and for all. Now, these kind of treatments are called modern treatments, and these modern treatments are expensive. Now, some examples of modern treatments, I'll say robotic surgeries, right? So sometimes if you have a surgery to sensitive areas like your brain, your spinal cord, your heart, inner parts of the groin, etc., that time, where even a millimeter shake, where a millimeter shake of the needle can have severe consequences for the senior citizen, these days, most hospitals will suggest robotic surgeries, where there is a robotic arm which will not shake at all. And so it is much, much safer for the patient. But unfortunately, these are expensive. 5 years back, robotic surgeries were very rare in India, but now it is so common in 2025, 2026 that every hospital has a robotic surgery department in it, at least the bigger hospitals. Okay. So, this is an example of a modern treatment. Most policies do not cover modern treatments. Make sure your policies cover modern treatments. But let me give you another example. There's also, for example, of course, unfortunately, cancer is so common in the world and in India as well. And one of the most common treatments of cancer is what we call chemotherapy. Now, chemotherapy is a very, my mother had it, so I can tell you that it's a very sad situation for the patient, right? You have to take, first of all, you have to take the patient to the hospital, make them sit there in one room, a big room, like a hall, where so many other cancer patients are sitting. They have to sit there for 3 hours and they have to get chemo. Chemo is nothing but they're putting in that chemical into your body, right? This is a very disheartening thing for a patient. And second thing is you have to take the patient to the hospital where they are exposed to so many other diseases. In the air, there'll be a lot of diseases. And ideally, if there's another solution, you would always try to take that solution. Now, these days, many cancers, not all cancers, but many cancers, and more cancers each day, have an option to take something called oral chemotherapy. Oral chemotherapy means you can take it as a tablet sitting at home with a glass of water, like any other medicine. Now, this is much better for two reasons. One is it's not disheartening. It doesn't kill the spirit of the patient. Patient is not exposed to unnecessary infection, etc., in the hospital. But more importantly, the side effects of chemotherapy. Normally, chemotherapy has very adverse side effects like loss of hair, nausea, loss of appetite, blisters on the tongue, scaling of the skin, etc. All this is 80 to 90% less when it is oral chemotherapy. Okay, so in most cases, in most families I've seen, if there is an option of oral chemo for that cancer, they will go for it. But it's expensive. It can be even 1 lakh per month for a tablet of for a set of 30 tablets that the patient has to have every day, one tablet. So either you should be super rich, or everyone in the family will pool together and struggle and pay it, or you should have a good policy where modern treatments are covered, so that these kind of this something like this oral chemotherapy will also be covered. Now, oral chemotherapy has 12, 13 things in it, but I've given you two examples. But my main thing, what I want to tell you is, it's very important that it gets covered, okay, especially for seniors. The next thing is outpatient expenses. See, many people run behind sometimes looking for policies where outpatient means you're not hospitalized, you're just going to a doctor is looking at your leg or looking at your fever and giving you medicines. See, this is not the main intention of policies. Health insurance policies are meant to protect you from big ticket expenses. So if you go for a policy with outpatient, not only is the cost of the policy premium going to increase a lot, but also there are a lot of limitations. They'll give you 300 rupees per visit. You have to do a lot of headache to get that 300 back. You have to take photo, then upload it, send email. So my suggestion is, even if there are policies with outpatient, pay that from your pocket, 700, 800,000 rupees. It's much better. I know sometimes there are some tests also, the doctors, so that's where you have to choose good hospitals to prevent unnecessary tests if possible. And avoid taking policies with outpatient coverage. Okay, so think of outpatient as zero. We are only focusing, take a policy which works well for when the bill is going to be in lakhs. And if in that case you're able to afford and take a policy with outpatient, okay, great. But usually if there's outpatient, as I told you, it's a balancing act. Somewhere else they will put some limitations so that you do not get enough money at the end. Okay, the next is intimation delays. Yeah, you should always make sure that, see, there's a lot of fraud, unfortunately. In India there's a lot of fraud. There are even sometimes claims that come to insurers where, forget patient is wrong, patient has no disease, sometimes that hospital is only not there. It happens in tier 2 and tier 3 cities, where they make fake bills and try. So basically the insurer has the right to come and visit the patient if required in the hospital, especially if the bill is slightly higher or if it's a complicated case. Okay, so
Oh, yeah, yeah, better.
it is important
Green
to
tea.
inform the
Green
insurer
tea,
that
है
it is important to inform the insurer that you have a claim coming, and this needs to be told within 24 hours. Okay, if it is a emergency case, if it is a planned surgery, if the doctor has told you that next week Wednesday we can do the surgery, please make sure that you inform the insurer 2 to 3 days in advance, so that all your paperwork will be ready and the claim can go through much smoother than going in the final step. Okay. Otherwise, if you miss these deadlines, sometimes you can get zero. Last but not the least, once an insurer identifies that a hospital has made fake bills or fake patients or any special thing which is not as per protocol, they will blacklist a hospital. So you should make sure that your hospital, see, if you go to a hospital, there is something called a cashless network. Or in an emergency, you may sometimes go to a non-cashless because that's the closest. So in a cashless network, if your policy is covered in that hospital as cashless, nothing to worry. It's obviously not blacklisted. But if it is not cashless hospital and you're paying and you expect that you come out, it will be covered, please make sure, just it will take 30 seconds on the insurer website to make sure that this hospital that I'm taking treatment is not blacklisted. Because if blacklisted, that means the insurer is saying, I don't believe the bills of this hospital. I have faced problems in the past. So I will not pay any bill from this hospital if you're treated there. Okay. And then there are minor reasons why you can get zero if your claim form has some incorrect information, missing documents, or even if your policy expires by 1 day. So please make sure this policy date is very important. Always make sure you pay your premiums on time so that you get continuous coverage without any break. Okay, so far these are the two major problems. One, we saw an example where you get partial coverage. Here we also saw some examples where you get zero. Now let's look at some solutions. So the first solution is you need to buy your policy very carefully. Let us look at three things we should not have and three things we must have in the policy. The first solution to these problems is you must try your best, if you're able to afford it, take policies where there is no room limit. So basically, there are policies in the market now, comprehensive policies, where it will say no capping for the room or no room, or it will say any room covered. So those, what does this mean? So if you go back to our example, if every room is covered, then you don't have to go with any stress. Whatever room is allotted to you by the hospital is fully covered, 100% covered. So once it's 100% covered, means everything else in the bill will also be 100% covered. There'll be no proportionate deduction. Okay. The second thing that we need to keep in mind is there should be no co-payment. Please ensure that you're not going where you're not taking a policy. You'll get 500 rupees discount in the premium maybe, but finally when co-payment is applied, you lose lakhs of rupees like we saw in this example. So please avoid co-payment. Third, we have already seen this. That is, we want to make sure that there is no disease limits. We have not seen this, sorry. So this is something we see in the example. So let me explain. So imagine, no, this person had 15 lakhs cover, let's say. So what many insurers say is this 15 lakhs is for the overall coverage in the year for this person. Okay. But if cancer comes, I'll give only 2 lakhs per year. Cataract surgery, I'll give only 25,000 per eye. Knee replacement, I'll give only 1 lakh. These kind, if you see a table like this in your policy, these are called disease limits. That means you have overall limit. That is what policy you bought, 10 lakhs or 15 lakhs. But uske niche, there is limits for different diseases. Avoid. So these are the three things we have to avoid: room rent limits, co-payment, and disease limits. Now let's look at three things in blue. We'll mark it in blue, which you must have in a policy. It's very critical. First is consumables must be covered. What are consumables? So when you have a surgery in a hospital, there are these disposable items, one-time use items like cotton, syringe, gloves, PPE kits, masks, blades. These are called consumables. They are one-time use items. They're quite expensive in hospitals, and it will be 10 to 15% of the hospital bill will just be consumable items. So please make sure that your policy, most policies do not cover consumables. That 10-15% आपके जेब से जाएगा. So please make sure that consumables are covered. Number one. The second is modern treatments. We already spoke about it. Why it is very critical to have modern treatments covered in your plan. The third final thing is a renewal bonus. See, because remember the point on inflation. So today in 2026, 10 lakhs is a good amount of cover. Now, depending on your age, by the time you are 80, 85 and really needing this policy, very, very important, it's going to be an important part of your life, you must have the cover that you need in that time. So if today you're 60 years old and today 10 lakhs is good, by the time you're 80, 20 years later, 10 lakhs will not be enough. You will need maybe 40 lakhs at that time, because that is the way the prices will be because of this 14% increase. So instead of taking 40 lakhs plan today, because that will be expensive,
Today, you don't need also 40 lakhs. You should take a policy of 10 lakhs, which grows slowly to 40. By the time you are 80, you will have this 40. So this growing happens through a system called renewal bonus. So every time you renew the plan for free, they give you extra bonus cover. So maybe you start with 10, but when you renew it, it becomes 15. Again, you renew it, it becomes 20. So something like that. You have to take a plan which has a good renewal bonus system. Now there are policies where you start with 10 lakhs, it will go up to 50 lakhs, 50 over time. So that is a good way, because you don't need 50 today. That time you need 50, and you're earning it. Every time you're renewing it, you're showing loyalty to the insurer, and they will give you a bonus every year. Okay. So these are the three things. So please remember, how much ever an agent may tell you, these are very critical. Avoid the three orange mark things, and take the three things which are in blue. There are many other points that you may find important, but that is, each person may have a different perspective, but these 6 points I think everyone needs. So please stick to this. Do not fall for these deals, any SMS which says 5,000 may cover. These are all fake things. You'll hardly get any money back. So please, if you're taking, take properly, otherwise save the money. That's okay. The next important, so we looked at what to buy. Now the next question is where to buy an insurance policy from. There are many ways. So let's say you decide a good policy. Question is from where to buy. Should we buy it directly online from the website of that company? Should we again buy online from an aggregator? Like, there are many aggregators. Policy Bazaar is an example, many others. Should we buy it from an agent, somebody's friend who's an agent? Or should we buy from a corporate intermediary, which is also an agent? This third and fourth are almost same. Both are agents, both are brokers, agents, intermediaries is the right word actually. But one is an individual, single person, and one is a company. Okay. So to understand this, no, first let's look at it from claims angle. So Indian insurers, there are a lot of terms in the policy. If you go and read, and we have read every line of every policy in the market, there are a lot of gray areas where the wording is not very clean. Sometimes, in insurance policies, you will also see that there is a clash. So for example, I can tell you dental is not covered in health insurance in India, but accidents are covered. Okay, so accidents are covered, one point will be written. Dental is not covered, some other point it will be written. So the question is, what if I have an accident and break my jaw and I need dental surgery? Will it be covered or not? Now, I've asked this question to hundreds of people, and at best, I get a 50-50 answer. Some people say it will be covered. Some people say the dental surgery will not be covered because dental is not covered. Some people say accident hai to accident cover hai to it will cover. So this is an example of a gray area, an area where there's some interpretation required. Now, if you have an expert with you, 100% that expert, good expert, like I can tell you that definitely this will be covered, because there are some rules of insurance, and no rules came under. Accidents are are most critical, and accidents are considered an act of God, and so anything related to accidents will be covered, dental or not dental. But most people will not know this, and insurance companies many times try to cheat people and not cover it. This happens sometimes, not cheat, maybe they will find some way to wriggle out of the claim. So basically what I'm saying is, when claims come, it is extremely important to have someone who can help you at that time, because diseases are complicated, hospitals are complicated, the treatments from doctors can be complicated, and your policy is also complicated. You bring all these things together at a time of claim, and so it gets complicated for an individual, okay, whatever age you are, to navigate without help. So you need to go where you get good help, especially at time of claims. The next thing to keep in mind is, at the time of renewals also, there are a lot of some little things that sometimes insurers introduce. Sometimes they will just increase your price by adding some new feature, but you don't want that feature, but they will add it by default, and आपका price बढ़ेगा. Sometimes I've seen some insurers who remind you every year, time for premium. But after a certain age, 70 ke baad, they don't remind, because unko nahi chahiye that customer. So they are hoping that you forget. I've seen all kinds of tricks. I'm not happy to say it, but these things happen sometimes. And so you need to, again, for this reason also, at the time of renewals, also you may need good support to prevent paying extra, Sometimes they may say, we have stopped the plan. You please move to this plan. Uska premium double hai. But they cannot stop any plan in India like that, because all plans in India have lifetime renewability. That is what IRDA says. So they can stop new people from taking that old plan, but they cannot push out people who have that old plan into a new plan forcefully. So these are some examples where you may need help at the time of renewal. Then updates. You may have updates. You may have changed your house, or maybe unfortunately you had a policy with your husband and your husband passed away. So now you have to make changes to the policy. So any kind of updates, you may want to increase your cover. You may want to add some rider, new add-on with someone as something has come, which is very useful. So updation of your policy also, you need help. You can try calling insurers directly. Many of them have bots these days, the automatic messages, and it's very difficult to even speak to a person these days, insurance companies. Okay. And lastly, there are a lot of free things that also sometimes your policy may have. Maybe a free health checkup every year, or maybe every year you can get a nutritionist consultation, or maybe there's something else free in the policy. So to make these, your bonus, I told you now, your bonus should increase. Is the bonus coming correctly or not? Is it applied? So all these kind of freebies that you're getting, also someone should be there, to help you see that everything is happening correctly. Okay. So because of these reasons, I would strongly, and please remember, wherever you go and buy a policy, there is no price difference. That is IRDA's rule. Whether you buy from the insurer directly, you buy from a aggregator like Policy Bazaar, or you buy from an agent, the price comes from the insurer's website, which is, say, whoever, HDFC ho ya Aditya Birla ho, you'll get the price from there. There's no difference. So when it's no difference and we want support for all these four things below, please go with option 3 or option 4. If you know an agent who will fight for you, who you can trust, who can and is reliable, you can go with option 3. Otherwise, if most cases we may not have that person, I would always suggest to go with a corporate intermediary. That means you must go with a broking firm who sells all kinds of policies, and make sure that that firm is there with you, so that you get the right advice while buying policies, but more importantly, you get good support at the time of claims. Okay. Okay. So now let's move on. So this is where we should buy a policy. One of this, 3 or 4. My suggestion is 4, because they sell much more policies than 3. So when there is a 50-50 choice, they can put more on the insurer to pass a claim. So that's the reason I've gone with 4. Okay. Okay. Now, for people who already have existing policies, there is a concept called porting. Just like you don't have to take, please never take, if you already have a policy, even if you'll get all these calls from these agents and these call centers saying, sir, naya policy hai, le lijiye. Never change your policy beyond age of 60, 65. Never go for a new plan, because usme waiting periods fir se start ho jayega. So when you transfer, this transfer is called porting. So when you port your policy from one policy to the other, your waiting periods are carried forward, which means, you understand what I mean? So for example, if you suppose aapka diabetes tha when you started your old plan, and it said 3 years waiting. Now wo 3 years ho gaya. Now when you transfer your policy, if you want to transfer, if you transfer, wo waiting period fir se start nahi hoga. It is carried forward. So always port. Never, do not fall for these people. They are all vultures. They will call you, telling you all kinds of things. Sir, premium kam hoga, ye hoga, wo hoga. Please make sure you never take a fresh policy beyond a certain age, because you're exposing yourself to risk. Okay. So you can port, but please keep in mind, there is a window when you can port. You can only port 60 days, start porting 60 days before your policy expires. You cannot port it. So today, if you come to me and your policy is expiring in December, we cannot do anything now. But uske 60 days pehle, we can start doing something. Number one. Second thing is, it gets harder with age and more diseases, more and more medical history if you have. So if you think your policy has some problems, you can try to please do it as early as possible, not very old, not beyond a certain age, and also before you get any serious illnesses. If you have diabetes, cholesterol, one or two of them, diabetes, cholesterol, asthma, thyroid, high BP, if you have one or two, you can port. But once you get more than two, it gets a little difficult. You can do it, but it gets a little difficult. Then there are also, you have to sometimes, to port, there may be some porting charges, some conditions. Like they'll say, I'll port you, you'll get a better plan, but you'll have to pay slightly some porting charge for it. Okay, so that either directly or indirectly they may put some porting charge, but still in many cases it is advisable to do that if your policy is improved a lot. That one time porting charge is still worth it because it can save you lakhs of rupees later. And lastly, whatever happens, no, please always make sure you review your policy once in 3 to 4, at least 5 years, because it's a very fastly evolving market. And in this market, there are a lot of features which were not available 5 years back, just standard today, like getting a free health checkup, or having a bonus in your policy. Things like that are so common these days, or having no room capping, like I said, is also getting more and more common. So you should always check. So people who have policies from 2000, 2005 and all, mostly their policy would be quite substandard. But we can't help everyone, but at least once you should get it checked, in my opinion, whether some option is there or not. Okay, so this is on porting. Now the next thing is, some of you may be on your children's corporate plans, which is perfectly okay. These are what we call group insurance policies. They are cost effective, less restrictive, good support. But the problem is, usually ये जो policies we get from our children's company, उसका coverage कम होगा. It will be 2 to 3 lakhs, maybe sometimes 5 lakhs. And the most important thing is, please understand that जब तक है it is good, but it is subject to changes. This year it can be 5 lakhs cover, next year it can be 2 lakhs cover, then it can be 3 lakhs, then 8 lakhs, then 5 lakhs. It keeps going up and down, and one fine day, if the insurer is not making money, profits out of that, they will withdraw. And it happened to my own wife's company as well. She had a policy for her mother, my mother-in-law. 8 साल के लिए था. Suddenly they said one fine day, company said, sorry, the insurer is charging too much, so we have to withdraw from this. So the problem is, so as long as it is there, it's a great option, but do not only have that. Please always remember that multiple policies can be used in the same claim. Okay, so you can use the corporate plan and you can have your own plan, and uske upar corporate jo whatever is balance, you can claim it with the second policy. This is all possible as per the rules in India, so it's not a problem. But again, if you have a intermediary who can help you, it's always beneficial. Okay, so that is on corporate. I don't know how many of you have it, but just thought I'll talk about it. We are nearing the end of our presentation, so basically let's summarize everything. So this is what we want ideally. Jo blue mein hai, hospital bill, and what settlement we get orange mein, should be equal to the blue. But let's summarize the problems we have seen. The first problem is, if you buy a policy without thinking carefully, without understanding your policy, and if it has some restrictions, then that restrictions will bring down the amount of money. So the blue will suddenly be the orange will be much lower than the blue, because of room rent capping, no consumables covered, modern treatments are not covered, etc., which we have seen already. The second reason is, and so to avoid this, you must choose right. Do not look for deals. This is the one thing where I would say, beyond the age of 60, it is worth paying the premium, as long as you select carefully and do it through an intermediary. Second, do not pay for anything extra that you don't need. So for example, some policies, I know senior citizens with maternity benefits, you're paying. So people think that, अरे क्या problem है, free में आ रहा है. Free में कुछ नहीं आता. It is actually inbuilt in your price. So please do not take things which are not needed. Okay. The next thing important is these gray areas. I told you, first thing, we have to choose right, but also we should buy it from the right place. There are a lot of gray areas in health insurance. So uske wajah se further your claim can come down. So these are the two reasons why you are not, if you don't choose right, that means you buy the wrong policy and you don't buy it from the right place where you get good support. That is where the problem comes. Otherwise, please remember, everyone, your health insurance is a legal document. And if you do these two steps correctly, and there's a third step. First thing, you should be honest. You should not hide anything. Next, you should buy the right plan. Third, you should buy it from the right place. 3 steps. If these 3 steps are done, it's a legal document. Nobody can stop us from getting what is truly ours at that time. Okay, so please do that. Also for the older people here, especially, most people are seniors here, right? Please be very careful. Do not fall for whatever you see on WhatsApp or some video and all that. Most of them, they are there to get clicks and likes, and they try to over generalize certain things, and also on the other hand make you scared unnecessarily. The truth is usually somewhere in the middle of these things. So again, if you have a good intermediary who you can trust, you can always double check whether something is true or not. Most of the things that I've seen personally are 50% true and 50% false, but they get good clicks because of that. And unless you're sure about something, please do not share things that you think may be beneficial to others. But if that video itself is galat, then you are actually spreading wrong things. So please pick your sources carefully for yourself, and also when you share it with people, because this is something that is insurance is something important. Okay, so now what? So first thing is, if you don't have a policy, and if you're under the age of say 70 or so, maybe if you're healthy, maybe 72, 73, should think of taking a policy, even if it costs a little higher. It makes it's worth everything. One single claim, you'll get back all your premiums and much more. But do it carefully. To do it, if you have a policy, I would highly suggest to get it reviewed. Maybe in some cases you may not be able to make any change, it's too late, but at least you understand your policy better, and you can navigate a claim better for you or a loved one. So at least if you understand, okay, I cannot change. In some cases we'll be able to change also, but even if we cannot change, at least if you know what you have now, at least your expectation is set, and we can help you navigate it better. The third, like I said, always use an advisor. Fourth, always maintain your documents, especially your medical records. Most people I know, they're buying policies for last 10 years. When I ask them where's the document, they'll say, oh, I have to find it, and things like that. So please maintain these documents. These are things that you need as an emergency. So please use that. Also keep all your past medical reports, not just for insurance, but also for treatment, right? Doctors also ask, oh, you had a surgery 10 years back. What happened there? Was there any complication or anything that can be there, right? So if you have any kind of reports, diagnostic reports, x-rays, scans, surgeries, keep those reports safely, and please let everyone in the family know where it is, right? Last but not the least, please remember, health insurance is only step one in preparing for an emergency. Especially for the men in the audience here, many men, they buy a policy for many years, but they have never shared it with their wife. They have just kept it in their WhatsApp or their email. In fact, there's absolutely nothing confidential in a health insurance document. You can share it with even a neighbor. If you're living alone, you should share your policy with a neighbor or anybody who you think will be the one taking you to a hospital. Sometimes you may be unconscious, right? And in the hospital, the first question they ask is, iska policy hai ki nahi? So please, and even talk to your children, share it with your children that this is my policy if there's any emergency. So that is one thing. And also please remember that, just because we have a good policy doesn't mean we want to go to a hospital. Please make sure you have regular checkups, at least the basic checkups, blood tests, and a few other tests, so that make sure that you're hale and hearty and healthy. And it's very important to catch many of these diseases early, not just from a financial perspective, from for your body, right? That's the most important, not just for health insurance. I'm saying all this. So now, last but not the least, firstly, thank you for your time. My name is Rahul. I lead a senior citizens welfare organization called Grey Up, and we help people with health insurance. We also help seniors with tax planning, filing, and making a will, etc. But today's focus is on health insurance. So we run consultations for people where you can either have a consultation for yourself, or if you're for your own family, or it could be your children also who may be married, maybe you have grandchildren. It doesn't matter. We do consultations where we help people with health insurance needs. And what can you use this consultation for? One is, you can use it to review your policy. So if you have an existing policy, like I said, it doesn't matter whether we can change or not. We can still review it and guide you and tell you what to do in a hospital when this happens. The second, if you want to port your policy, that is, you want to convert your policy from one to the other, the consultation can be used. Third, if you don't have a policy till now, but because it was complicated or you did not trust someone, but now if you feel open to it, you can come for a new policy, and we can also use give you a consultation for that. And last is, if you know somebody or you've had a claim rejected recently, you can also try, even though we are not officially involved as your representative, we can at least guide you and help you to do a claim. Okay. And to do this, you can book a consultation with us through Vayah Vikas. The team will get in touch with you after this session, and they will ask you if you're interested in a consultation, and you can let them know. and they will organize that with us. We also help younger people with term plans, which is life insurance, and we also help older people with travel insurance. So if any of you are traveling abroad, jahan pe there's a necessity to take travel insurance, we can help you with that as well. Okay. So that's it. And with that, come to the end of the presentation. Thank you so much. I know it's a little dry topic, but I've tried my best to tell you as logically and hopefully clearly as possible. But now we can open the floor to questions.
Thank you. Thank you, Mr. Rahul, for such an insightful and practical session. Today's discussion has helped us better understand the finer aspects of health insurance, the importance of reading policy details carefully, and how informed decisions can help avoid challenges during medical emergencies and claims. Hope all our participants found this session useful and feel more confident navigating health insurance related discussion.